Postoperative nausea and vomiting, also known by the acronym PONV, is a significant complication with anesthesia practice that affects a large quantity of surgical patients on a daily basis. Statistics suggest that nausea, an uncomfortable sensation accompanied by stomach distress and an urge to vomit, is estimated to affect 50% of post-surgical patients, whereas vomiting, the aggressive expulsion of gastrointestinal contents via the mouth, is estimated to affect 20 to 30% of all post-operative patients. So why is this an issue? Although nausea and vomiting are part of the body's protective reflexes against toxins and certain stimuli, many post-operative patients have described the sensation of PONV to be more distressing and uncomfortable than post-surgical pain itself. However, through further investigation, researchers found that in many cases, PONV led to a number of other health-threatening complications such as aspiration, dehydration, electrolyte imbalances, venous hypertension, pain, and disturbances to incision sites, causing suture tension and bleeding. As well as physical complications, researchers have also identified a number of psychological issues developed with association to POV. These include anxiety, shame, embarrassment, and fear. These issues have further potential to prolong patient hospital stay as much as 25%, thus increasing costs of healthcare supplies and resources. So why hasn't it been fixed? It is understood that there is a direct link between anesthesia and post-operative nausea and vomiting, which has allowed clinicians to transition from anesthetics such as ether and chloroform, where the incidence of PONV in post-surgical patients was 75% or 3 in 4. However, studies have discovered that anesthesia is not the sole influence for the occurrence of PONV, which is why it is still an issue affecting 30% of average and 80% of high-risk patients on a daily basis. Assessing the risk of post-operative nausea and vomiting by Cambridge K separates these factors into 3 distinguished categories: patient, surgical, and anesthesia-related factors. Some patient factors that may increase the individual's risk of experiencing PONV include gender, where women are 2 to 3 times more likely of experiencing PONV and at a greater intensity. A history of motion sickness due to a patient's decreased threshold to nausea and vomiting. Patients who were or are non-smokers were found to have a lower tolerance to anesthetic gases, and other considerations include age, weight, history of migraines, delayed gastric emptying, and pain. Evidence also suggests that a number of procedural factors are linked to an increase in risk. Examples include the duration of a surgical process, where the surgical procedure beyond 30 minutes may increase risk by 60%, and other factors include patients undertaking laparoscopic and abdominal surgery, gynecological surgery, and ear, nose, and throat procedures. Anesthesia-related factors include the use of opioids such as fentanyl and morphine, which have been found to increase patient risk, the types of anesthetic agent, any pre-medication, and the duration of anesthesia. So what is the best way to prevent and manage post-operative nausea and vomiting? A document called the Consensus Guideline for the Management of Post-Operative Nausea and Vomiting, constructed by the Society of Ambulatory Anesthesiology, which is also supported by the Australian and New Zealand College of Anaesthetics, discusses the latest prevention strategies and management options for PONV that have been supported by evidence-based practice. The first guideline involves the identification of patient risk factors through assessment and discussion. Studies found that there is a significant correlation between patient lifestyles and health factors and a heightened risk of PONV. However, due to the list of factors being extensive, as discussed earlier, clinicians have developed a simplified risk score system that identifies the major risk factors with the highest prevalence in PONV patients. By simply asking patient questions and undertaking primary assessments, health staff can quickly and easily grade a patient's risk, providing a structured target list with suggested evidence-based focused healthcare interventions. The second outline aims to reduce the baseline factors. It does so through addressing the complications identified in the first guideline and acting upon the evidence-based interventions suggested to reduce a patient's risk. Examples of this include keeping a patient well hydrated to avoid dehydration and the use of regional anesthesia instead of general anesthesia, as there is a lower risk of postoperative nausea and vomiting. Guideline 3 aims to provide management and treatment through pharmaceutical means, specifically antiemetic medication, drugs used for the treatment of nausea and vomiting. The guideline identifies the most effective antiemetic postoperative and nausea prophylaxis with considerations with the findings of Guideline 1 and 2. The most common antiemetic used in today's healthcare is 5-HT3 receptor agonists. However, others include NK1 receptor agonists, corticosteroids, and many more. The recommended dose and timings for these vary, and the respective drugs are included on the antiemetic dose and timing for prevention of POMV in adults table within the consensus guidelines. Guideline 4 directly targets patients at a higher risk of aggressive POMV and highlights the effective use of multimodal approaches to significantly reduce patient risk. For example, a systematic review addressing effectiveness of drug combinations found that the compatibility of 5-HT receptor agonists and dexamethasone provided a treatment with greater effect than any monotherapy designed for POMV. There are a number of other guidelines within the consensus document, however these target specific patient demographics and aim to provide best prevention and management techniques for their circumstances. Before implementing these guidelines into healthcare practice, it is important to identify any possible challenges or barriers. Healthcare costs may become a challenge faced when implementing these strategies. Researchers suggest that patients are more likely to purchase comprehensive management and prevention plans that may be unnecessary. By making treatment guidelines more complex and comprehensive, there will be a greater need for resources and medical supplies, directly increasing hospital costs. However, as the implementation of the interventions within the guidelines become more commonly adopted within hospitals and healthcare centers, both costs of pharmaceutical and non-pharmaceutical products will decrease. Within the healthcare setting, some new interventions and guidelines may take longer to be implemented due to poor nurse compliance. It is occasionally seen, even after educational in-services and seminars, nurses and other healthcare professionals were found to have difficulty transitioning from their typical routine within their place of practice. Thus implies that healthcare professionals may not be providing the most adequate and effective care for their patients. By introducing these new guidelines via a quick and user-friendly electronic system with regular updates and notifications, these regular notifications will promote and remind staff to adhere to the new changes in practice. The guideline is effective at providing specific best practice information and interventions whilst minimizing additional work for healthcare professionals. However, it is important to acknowledge that some less significant information may be neglected from the assessment and management tools. Hence, it is important for nurses and staff to attend regular educational seminars in order to obtain additional necessary information to optimize clinical thinking skills and reduce the risk of missed complications. Although providing the most up-to-date and recent evidence-based interventions for POMV, the consensus guideline identifies the need for further investigation and direct research into physiological and psychological impacts on patients, ensuring the promotion of effective care and positive patient experiences.